Today, we are going to learn about something that happens often in sports and daily life, that is ankle sprains. So, we will talk about what an ankle sprain is, different types of ankle sprains, why and how do they happen, and what happens inside ankle during a sprain, which ligaments are included, and why some sprains are more serious than the others. Yeah. Coming to the pathomechanics of medial ligament injury. So first let me explain, there are two types of ankle sprain. So the medial sprain, that is inner side, also known as eversion sprain, whereas the second one is the lateral, that is outer side sprain, also known as inversion sprain. So coming to the medial ligament injuries, eversion, that is eversion sprains in short. So this is when the foot is rolling outward and the inner side stretches. So this is less common than any other sprains. Why? So because the lateral malleolus, that is the outer ankle bone, protects the inside part, it acts like a wall to block extra movement. Also the medial ligament is very strong, so to tear it, the force has to be really high, so strong enough to break bones like tibia or fibula. So remember, eversion sprains are rare, but when they do happen, they are usually very severe. They often happen along with the fractures of ankle bones. Yeah, coming to the lateral ligament injuries, inversion sprains. So this is when the foot rolls inward, the most common type of ankle sprain. It often happens when you land on an uneven surface, you step wrongly while walking or running, you twist your foot during sports. So let's learn about the ligaments involved. Yeah, so as we all know, ATFL, that is anterior talofibular ligament, this is the first ligament to get injured. So happens during plantar flexion, that is pointing toes downwards. And CFL, that is calcaneofibular ligament, injured in more serious or deep inversion sprains. So these ligaments here, when these happen, the ankle becomes unstable. That means it could feel like giveaway, or you may feel not safe standing or walking. You may feel the pain or swelling over the ankle. So coming to the effects of inversion sprain. So if only AFTL is torn, the ankle is unstable, mainly when you point your foot downward. If both AFTL and CFL are torn, the ankle is unstable in any position, whether you're walking or running or standing. If the tibiofibular ligament, front or back, are also injured, so then the whole ankle becomes very unstable. This is a very serious stuff. Yeah, coming to the syndesmotic high ankle sprain. So there is another type of high ankle sprain, which is also called syndesmotic sprain. So what is syndesmosis? So it is a group of ligaments that connect your ankle to your shin bones. So this is the common type which is seen in football players and athletes. So this type of sprain, which causes long lasting pain, takes longer to heal, may need surgery if it is severe. So how do these ankle sprains happen? So there are three ways, especially speaking. So the first one is external rotation of the foot, that is the foot turns outward and the talus bone gets pushed into the ankle joint. This widens the joint and stretches the ligaments, which is more common in skiing and soccer players. Whereas the second type is forceful eversion of the talus. So the whole ankle shifts, or else the strong syndesmotic ligament gets torn. So this is a very serious and severe injury. Whereas forceful dorsiflexion, that is the third type. So when the foot is pushed upward forcefully, or when the talus bone moves, pushes the fibula outward, or this damages the normal joint shape. So all these injuries make the ankle unstable and painful. So recovery may take weeks to months. So coming to the summarization, so let's review. Here's what we learned today. So ankle sprain is an injury to the ligaments around the ankle, as we all know, and the inversion sprain, foot rolls inward, is most the common one and damages the AFTL, ATFL and CFL ligaments. So the eversion sprain is less common and may happen with fractures as well, but often worse, may accompany with the fractures. So high ankle sprains affect deeper ligaments that connects the shin bones. So they are more serious and needs longer healing time. So as a future physiotherapist, you must identify the type of sprain, know which ligament is involved, and plan a treatment to restore strength, mobility and balance accordingly. So this is all about the ankle fractures that we have learned today. I hope it would be really helpful for you. Thank you.